For people across different communities, this is a time of uncertainty and fear, certainly something that shouldn't be left ignored.
Yes, that's why today we have clinical psychologist Dr. Sheryl Ziegler is joining us for the second time, actually. She actually helped us out several months ago, so thank you for being here.
Thank you so much.
So I want to know, like, what have you seen, like, whether it be with your patients or within the field, like, leading up to and post-election? Like, how is it impacting people emotionally?
So I would say my experiences leading up to, there was a ton of anxiety.
Yeah.
Then we got sort of swift results, which I think was surprising for a lot of people. It was like, oh wait, we thought maybe this was going to drag out for longer, and it was like, nope, not that way at all. And then since then, I feel like very mixed, just like the results. There are some people that are happy. There are some people that are really scared. And I would say, because I work with a lot of adolescents, that the teenagers are like asking a lot of questions. Like they're like, what does this mean? And why are people scared? And should I be scared? Like, what's going on? So I've been happy to see that the middle point, they're not voters yet, but they're starting to think that way. They're sort of like, all right, what does this actually really mean? And the challenge is in answering that question right now too.
I feel like that's so important too, to like begin to have those conversations at those younger ages so you can have those discourses and those places to where you can learn understanding and to have those conversations to where maybe you might not agree with somebody, but you can have an open discourse.
Absolutely. And I will say, like, in my circles, from a lot of people that we heard from in these interviews and like things that I've seen on social media and within my conversations, there is a lot of anxiety and fear. And I want to ask you, as someone who works in therapy with other folks, what are some ways that we can deal with that? Like self-regulation tips, coping tips, like what would you recommend when we're feeling a lot of this uncertainty and fear that we don't really know what to do with?
Yeah. So one thing I'm going to share is something that I've actually really been doing myself, and I'm like continuing to do it, and I haven't stopped. So it's been so great, which is limiting my social media in general, not having the TV on, just, as background noise, because right now it's just too unknown. The anxiety's too high, and I think the country's too split. And so I say the first thing to do is really limit that. Just limit it. Be intentional. So if you want to know the news, find your source, limit it. Say, okay, I'm going to 20, 30 minutes, whatever you're going to do. I'm going to watch the show. I'm going to listen to this thing. I'm going to listen to this podcast, whatever it is. And then I'm going to shut it down.
Yeah.
And then you want to re-engage with your actual community. So instead of thinking so big, what's going to happen to the country, right? That's really big, even the world. Just think really small. What can I do in my community? What can I do in my whatever that is, my group of friends, my church, my school? Think small. I think that's where right now at this time of anxiety, we're actually going to feel the most empowered. If I try to think that I'm going to try to help the entire country right now, that might feel really overwhelming. But if I think I'm going to have a great conversation with you all, and then I'm going to go and have a great conversation one-on-one with somebody, and I think small but intentionally, I think I feel a lot more empowered, and that's what the research shows as well. So that's the kind of advice I'm giving to people. Keep it small.
Would you also say some of those small things, like just going outside, like you said, having those conversations, making sure you're hydrated, eating, contributes to all that?
Absolutely. Sometimes I forget, because to me that's such a foundation of health, right? So we do need to be getting outside, sunshine, connecting with others. That's the number one tip though. Always connecting with others, healthiest thing you can do for yourself. But the exercise and sleep. So you got to protect your sleep. You got to be thinking about your sleep hygiene. Like, don't be on a screen right before bed. It's stressful. Read or listen to music or meditate. Do something that it will just make you feel calmer. So I'd say protect your sleep. That's something that I've been getting more calls from the early 20-somethings on, is their sleep's been real affected.
It's tough for sure. My last question would be, just kind of like you said, it's easy to kind of get wrapped up in the bigger picture and get overwhelmed. And with that, something that I've been hearing from a lot of my friends and just people I've been talking to is like some shame and guilt to even feel this anxiety and fear, because we are all, obviously, we have intersectional identities and we're privileged in areas, like I will say I'm very privileged. And so there's some sort of guilt that comes with this fear and anxiety. Like, what would you say to people who maybe are feeling that way?
Yeah, I hear that a lot with so many different things. It'll be like, oh, I don't have a right to feel upset about this because there's so much bigger things in the world, or there's all these other problems in the world that are bigger, more significant. And that actually does the whole world a disservice, really, when you do that, because it's part of self-care to honor what you're feeling, what your experience is. So for me, if I have certain things that I'm worried about now, which I do, then if I disregard that, then I'm losing out on an opportunity to help myself be better, to maybe be a better parent, to maybe make the change in my community that needs to happen because I keep downgrading what I'm thinking. If you're feeling, what I like to say to people, if you're feeling and thinking a certain way about a certain topic, you are not alone. There are other people, and sometimes you need to use your voice to put it out there so other people go, oh, I thought it was just me that was worried about that, and that it was so unimportant.
A lot of the times is those people are like, wait, what? Like, you're also experiencing this? And
I'm allowed to? Because if you're allowed to, then all of a sudden I'm allowed to.
Exactly.
Right.
Yeah.
Absolutely. Take care of yourselves. Use your voice. Don't feel bad. Your feelings are valid.
Absolutely.
You heard it from her. She's a mental health professional. Listen to her.
I'm
Don't listen to me.
authorized to say this.
Listen to her.